So now we will discuss about the neurotransmitters and how they are gonna act on the different types of receptors. So first of all, what is meant by the neurotransmitter? It is a chemical substance produced by the neuron, specifically at the synapse or at the end organ. Either it will act on other neuron end or some other organ. So it has two effects to do. It will go and communicate with the other neuron, otherwise it will go and stimulate the organ. So there are two types of receptors in the body for neurotransmitters. Those are inotropic and the metabotropic. So we classified them two types based on how they function once the neurotransmitter come and bind with them, and how they are performing their action. So if you see the inotropic receptors, so these are mainly the ligand gated ion channels. So what is meant by ion channel? So once the neurotransmitter come and binds to this receptor, so there will be some conformational changes around the receptor, and it will allow the influx of the some ions such as sodium, calcium and chloride. So once these ions come inside of the neuron body, so there will be either excitation or inhibition. Okay, so either excitation or inhibition will be there, then the effector organ will show its effect based on the neurotransmitter. Okay, so if you see deeply, the sodium ion influx, it will cause the depolarization, and the chloride ion influx will cause hyperpolarization. So we know that the depolarization means the action potential will be increased, then we will see excitation of the neurons. Because of this hyperpolarization, the neuron will be inhibited. Okay, so based on these two mechanisms, if the receptor increases the sodium influx, the excitatory effect will be there. Otherwise, if any neurotransmitter increases the chloride influx, the inhibitory effect will be there. Okay, so now let us move to the different types of neurotransmitters which will act on the inotropic receptors. So coming to the acetylcholine. So we know that acetylcholine is a neurotransmitter it's a principal neurotransmitter in parasympathetic nervous system. Okay, but we have two different types of receptors in parasympathetic nervous system. One is nicotinic and the other is muscarinic. Okay, so these nicotinic sites are nothing but they have this inotropic type of receptors. So once the acetylcholine go and bind with these receptors, there will be increase in the sodium ion influx. So that will lead to the excitation, and it will show some excitatory effect. Okay, so similarly the glutamate, it is a neurotransmitter. It also comes under the excitatory neurotransmitter. So it acts on the NMDA receptors. The NMDA receptors are inotropic. So the mechanism of action of the glutamate is similar to the acetylcholine on the nicotinic sides. So it will increase the sodium influx and it will excites. And the drugs whichever will inhibit the NMDA receptors will show the inhibitory effects. Okay, the main clinically the main example for this is the ketamine. We use it as a dissociative anesthetic especially in the induction of the anesthesia. So the ketamine, what it will do is it will go and inhibit the NMDA receptors. So usual function of NMDA receptors is excitation. So if something is blocking that action, then the resultant action will be inhibition. So that's why it will dissociate the animal from the normal consciousness. So now let us move to the two other different types of neurotransmitter, which are glycine and GABA type A. So there are two types of GABA neurotransmitters. One is GABA A and GABA B. GABA A comes under GABA A will act on the inotropic receptor, and the GABA B type will act on the metabotropic receptors. Okay, so these two receptors, they will increase the influx of the chloride ions. So I already mentioned that the chloride ion influx will leads to the hyperpolarization. It will leads to inhibitory action. So inhibitory type of action will be seen with these two neurotransmitters. Okay, so we know that glycine is showing the inhibitory effect. If any substance, otherwise any drug, blocks the site of the glycine receptors, that will leads to the excitatory effect. So the main example we discuss about this in toxicology section, that is strychnine. We will see the strychnine poisoning in case of large animals. So where we will see some excitatory effects of the nervous system. Okay. So in the final neurotransmitter which will act on the inotropic receptors is 5-HT type 3. This 5-HT nothing but 5-hydroxytryptamine, otherwise known as serotonin. So there are almost 7 types of serotonin transmitters. Sorry. So among those, the type 3 will use the inotropic receptors. So we clinically use ondansetron to control the vomiting. So that ondansetron will come and inhibits this 5-HT3 effect. So the effect will be once 5-HT3 comes in contact with the metabotropic, once the 5-HT3 comes to the inotropic receptors, it will increase the sodium and calcium ion influx. It will lead to the excitatory effect that will be shown in the form of vomiting. So once if we give the ondansetron, it will antagonize the effect of 5-HT3 and the vomiting will be controlled. So this is all about the inotropic receptors, different types of neurotransmitters which involves in these receptors and their clinical relevance. So coming to the metabotropic receptors. So the main difference between inotropic and metabotropic is here the action of the neurotransmitter is very quick. The onset of action will be very quick, but the duration of the action is very low. Okay, so it will show its effect for the short duration, whereas the metabotropic, the onset of the action is very slow, but the effect will be long lasting. So this mechanism of action, if you take, the neurotransmitter comes and bind with the some subunit of this G protein. So the G protein coupled receptors, GPCRs, G protein coupled receptors are nothing but the metabotropic receptors. So these G protein usually they have some alpha, beta and gamma and subunits. In those, the alpha is the main subunit which will decide what type of action the G protein is going to do. So the G proteins located on the this cell membrane, once the neurotransmitter binds with the particular type of G protein, it will either inhibit or stimulate certain enzymes. That will leads to production of some secondary messengers, and these secondary messengers will carry the information of this neurotransmitter to the inside of the cell, and the cellular functions will be altered depending on the neurotransmitter binding to this G protein. So this is about the metabotropic receptors. So now let us move to the metabotropic receptors. So we know that the metabotropic receptors, they are situated in the cell membrane, and once the neurotransmitter comes and binds with the receptor, it will either inhibit or stimulate the enzymes, and that will leads to the production of some secondary messengers, and these secondary messengers will carry the information of the neurotransmitter, and it will give the end product, end organ. Otherwise the cellular function will be changed according to the neurotransmitter. Have you ever wondered that drugs like albuterol and salbutamol is able to control the asthma, and how the xylazine is able to reduce the heart rate, and how the atropine is able to increase the heart rate? In similar way, how does the ranitidine is able to control the acidity, how it is reducing the acid in the stomach? So if you want to know the answer for all these, you should know about the G protein coupled receptors and how they function based on the neurotransmitters. Okay, now let us move to the classification of these G protein coupled receptors. So they are divided into 4 types: GS, GI, GQ and GO. Okay, So the cheat code for you is I means inhibitory, inhibits. The effect will be inhibitory action. Okay, the GI, the neurotransmitters which are going to bind with the GI receptors, they will show the inhibitory action. Okay, whereas if you see the GS and GQ, they are, one common point in them is they are stimulating certain enzymes. Okay, here the GS receptor, it will stimulate the adenylate cyclase, and the GQ receptors, they will stimulate phospholipase beta. Okay, these two enzymes, if they are activated, we will see the excitatory action. I mean, we are going to see the positive effect. Okay, but the only difference between GS and GQ is the types of enzymes they are stimulating and the secondary messengers they are utilizing. Okay, here the CAMP will be utilized as the secondary messenger, but in case of GQ, diacylglycerol and IP3, inositol triphosphate, these two are utilized as the secondary messengers in order to show the effect of the neurotransmitters for the GQ receptors. Okay, and the last one is the GO. These GO type of receptors, the main function is the slowing down of the potassium channel closure. If the potassium channels are closing slowly, then that will lead to the very slow onset of the depolarization. Okay, so that will show the effect. And now see here, if these type of neurotransmitters will work on the GS type of receptors. Whenever these neurotransmitters come and bind with the GS, this enzyme is activated and it will increase the SCAMP. So the final effect will be increased the excitation. Okay, so now let us see in detail. So the norepinephrine, it comes, the neurotransmitter is a principal neurotransmitter in adrenergic nervous system. So we know that adrenergic nervous system is fight or flight, like it will increase the heart rate, and otherwise it will make you to jump from the site. Okay, it will produce more energy, like you are going to run, and that will be achieved with increase in heart rate only. So the norepinephrine, it will act on the beta sites. So the beta sites are having the GS type of receptors. So the beta sites, if we see in detail, the beta 1 receptors are located in the heart, and the beta 2 receptors are located in the bronchioles and the uterine muscles. Okay, this is about the GS receptors. Okay, if you see the norepinephrine effect on the heart, it increases the heart rate. We already discussed, because of this action, these two actions, the excitatory effect will be there. That's why the heart rate is going to increase. That is the reason behind why norepinephrine is able to increase the heart rate. Similarly, it is able to dilate the bronchiole. So that is how the beta 2 agonists are able to control the asthma. So that is the reason behind the action of the albuterol, which is the beta 2 agonist. Okay, so now let us move to the 5-hydroxytryptamine. The type 4 to 7 are having the GS type of receptors. The type 2, we have already discussed, the 5-hydroxytryptamine type 3 receptors are inotropic, that is ondansetron is an antagonist for that. So now let us see the histamine. Histamine, the H2 receptors, there are two types of receptors for the histamine, H1 and H2. The H2 receptors located in the stomach, once they are activated, they increase the acid production. Okay, so if we want to decrease the acid production in the stomach, we have to use the blockers, histamine H2 receptor blockers, such as ranitidine and cimetidine and famotidine. So that's why the ranitidine is able to control the acid production in the stomach. Okay, this is the main physiological mechanism behind the functioning of the different organs we regularly use in our clinical practice. So now let us move to the GI. So GI, the name itself indicates inhibitory. So the action will be inhibitory action. Okay, So if you see the noradrenergic adrenergic nervous system, so the for the norepinephrine, if they go and bind with the alpha 2 receptors, it will be the inhibitory action, because the alpha 2 receptors are located in the presynaptic neurons. This is kind of a negative feedback mechanism for the adrenergic nervous system. So once these alpha 2 receptors are activated, otherwise bounded, alpha 2 agonist go and bind with the alpha 2 receptors, then there will not be any further release of norepinephrine into the synaptic space. So that will lead to the inhibition of adrenergic outflow. Sympathetic nervous system outflow is going to reduce because of the alpha 2 agonist. That is the main reason the xylazine is able to decrease the heart rate. Okay, because the sympathetic nervous system, it will increase the heart rate. If something is going and attached to the alpha 2 sites, then there is no releasing of the norepinephrine, and that will lead to the decrease in the heart rate. Okay, so the GABA B type of receptors, they use the GI type. So this will be inhibitory action. We have seen the similar action of inhibitory action with the GABA A type, where the transmitter uses the inotropic receptors. So now come to the GQ type. So this GQ type, after stimulating this enzyme, it increases these secondary messengers and it will lead to the excitatory effect. So if we see norepinephrine, the alpha 1 receptors, these alpha 1 receptors are mainly located in the arterioles. Okay, arterioles. So as I said, the GQ receptors and the GH receptors are excitatory, and they will show the constriction. Once the norepinephrine go and bind with the alpha 1, it will constrict the arteriole. Once the arteriole is constricted, then that it will lead to the hypertension. Constriction of the arterioles means increase in the peripheral resistance. Okay, if the peripheral resistance is increased, then it will lead to the pooling of the blood in front of the arteriole, that is nothing but the hypertension. Okay, so coming to the acetylcholine, for the neurotransmitters like the acetylcholine, so we know that acetylcholine have two types of receptors which they work on. One is muscarinic and another one is nicotinic. The nicotinic type of receptors are ionotropic and the muscarinic receptors are metabotropic. So the M1 and M3, so these two receptors are present on the heart. So no, the M2 and M4 receptors, M2 and M4 receptors are present in the heart. So I forgot to mention about this function of the acetylcholine. So since the heart is having these M2 and M4 receptors, so once acetylcholine go and do and bind with these receptors, it will lead to the inhibitory action, that is reduction in the heart rate. So that is the reason why if any drugs which can antagonize the muscarinic receptors on the heart will subsequently show the increase in heart rate. That is the reason why the atropine is able to increase the heart rate. Okay, now you have got an idea how does different types of drugs are able to control certain effect based on the type of receptors they are binding with. Okay, so this is about the GS, GI and GQ. So now coming to the last one, GO. So this GO type of receptors uses 5-HT type 2A and type 4 and acetylcholine M1 receptors. Apart from these, the dopamine 1 receptor is of GS type and the dopamine type 2 receptor is of GI type. Okay, this is all about the metabotropic receptors.